Hello, I'm Dr. Greg Winteregg with this week's MGE Tip of the Week. For this week's tip, I want to talk about how to find an associate. As your practice is expanding, or possibly as you're considering slowing down, you're going to have to get another doctor in there to maintain the production or expand it. And it can be very confusing. Different doctors come with different recommendations, different requirements, different pay scales, different services that they can offer, and sometimes it can be a bit overwhelming. Well, the first thing that has to happen is you have to know exactly what it is that you have to offer and what it is that you're looking for. If you want this new associate to be able to do some specialty services like implants and endodontics, then that has to be promoted and advertised, and then you attract those kinds of doctors. But it has to be very clear to you, is there a partnership in the future? What are the hours? What kind of services they will be providing? Then you know what it is that you have to offer. The analogy that I use, it's like when you're selling your home. You have a 3-bedroom ranch with a den, and someone comes in and they're willing to make you an offer on the home if you put in a pool. Well, you're not going to accept that offer. So you have a particular type of home you're selling, and you're only looking for one buyer. That's how you should be looking at this with the associate. So be very clear that you know what it is that you're offering. Okay, then once that's clear, then you're going to have to let everybody know that you're looking. You advertise in your dental journal, newsletters, let your lab man know, your supply man know. Call all your friends. I just called every friend that I had, and I let them know that I was looking for an associate. And quite actually, that's how I ended up finding the associate who ended up buying my practice after a couple of years here at MGE. So just let everybody know. Now you're going to have a candidate. Interview that candidate, let them know what you're looking for. If they're left-handed and there's no way you can put in left-handed equipment, then it's sort of like they want you to put in a pool and you can't. So you have to look at it from that particular perspective when you're doing the interview. Now the next step would be having them come in for a working interview, and what I suggest is you let them work on your staff. Have them do a minor procedure on all of you. Then you can have them work for you for a day or two on a per diem, and you have to check all of their work to make sure that you have the same clinical standards. Finally, give them a basic treatment plan, and let's see how they would treatment plan it. If there are massive differences in viewpoint, even use a simple example like resin versus alloy, and you can't come to an agreement on that, then this obviously is going to be a marriage that isn't going to work. The water can be very murky, it can be very confusing at times, but if you have a few stable datums that you're going to operate off of and what you're looking for, you'll do great. And that's my tip of the week.